Rocky Mountain spotted fever is caused by the bite of an infected tick, typically a dog tick. The infected tick will transmit the organism Rickettsia rickettsii through its bite. The tick must be attached to the human for 6 to 10 hours in order for that organism transfer to occur. Since it can be very difficult to tell how long a tick may have been attached, knowing about the symptoms of this disease is extremely important. Rocky Mountain spotted fever was first identified and described by Major Marshall H. Wood in 1896 in Boise, Idaho. 10 years later, Howard Ricketts connected the cause of the disease with the specific organism, so Rickettsia rickettsii was named for him. Originally, the disease was confined to the Rocky Mountain states in the western half of the United States, hence the name, but by the 1930s, it had spread to the rest of the continental U.S., Canada, and Mexico. Today, it continues to be very widespread throughout North America, but the highest concentration of cases is in the southeastern part of the United States. The symptoms of Rocky Mountain spotted fever take about 3 to 12 days after the bite of an infected tick to show up on the patient. These symptoms are usually a high fever, a very severe headache that becomes worse with bright light and eye movement, muscle pain, nausea, vomiting, lack of appetite, and then usually about 5 days after the onset of the high fever, that distinctive rash appears. The rash will appear first on the wrists and ankles of the patient, and then move to the palms, feet, up the extremities, onto the trunk and buttocks, and onto the neck and the face. The rash begins as small pink spots and then becomes raised and much darker in color over time. There are even some instances of this disease without rash, so it can become very challenging for physicians to adequately diagnose. The best way to diagnose this disease is through a blood serum testing that specifically identifies Rickettsia rickettsii. But labs do not typically complete this specific blood serum testing unless ordered by a physician. So it can be very challenging for the physician to make that identification in an early enough time to truly treat the patient. In fact, nowadays, a medical best practice is to attempt to rule out RMSF for any patient who sports a sudden high fever who also lives in a tick-infested area. So patient education, physician education, and knowing about the symptoms, risk factors, and how to prevent this disease are truly very important. Once this disease has been adequately diagnosed, the treatment is fairly straightforward. Oral and IV antibiotics, if administered within the first 5 days of symptoms, can result in a patient who makes a full recovery. The IV antibiotics are usually used for a patient who is exhibiting intense vomiting, since obviously an oral antibiotic may not be quite as beneficial. So if it is identified early enough, the patient should make a full recovery. Anyone who has been bitten by a tick can get Rocky Mountain spotted fever. Whether you're a child or an adult, your chance is equally likely. Now, that being said, Caucasians are twice as likely as African Americans to actually be diagnosed with the disease, but African Americans are much more likely to die from the disease. Some individuals feel that this may be because African American skin is much more pigmented, so it can be more difficult to see the telltale red rash that makes this disease so well known. Children between the ages of 5 and 9 and adults between the ages of 60 and 69 are more likely to be diagnosed. Males are more likely than females, but again, any person who's been bit by an infected tick could become infected. Because of this widespread risk factor, prevention is truly key. If you have to be in a heavily wooded area that ticks enjoy living in, definitely make sure that you try to utilize repellents for both you and your pets. Upon leaving that heavily wooded area, do a thorough check of both yourself and your pets to ensure that there are no ticks that are hitching a ride. If a tick has burrowed in, safely and quickly remove the tick and then begin watching for any symptoms. Remember, if you are bit and you get sick, see a medical professional right away. Thank you for watching.